Hello, this is Dr.J. Hartley with Taylor, and we're showing you the benefits of getting adjusted when you're pregnant. The first thing we're going to do is a neurological leg check. Go ahead and slide back on your back, Taylor. And we're going to check her leg length. And today it's short on the left. That tells us about pressure in the upper neck. And the upper neck is very important when you're pregnant because it has an effect on the vagus nerve, which has an effect on the uterus. So we want to make sure that is healthy. So turn to your side and go ahead and stand up for me, Taylor. And we have a special table that we use with adjusting pregnant women. And this piece drops away. And as the pregnancy goes along, women don't spend a lot of time laying on their stomach. So they like to be able to get into this position. And it helps to open up the nerve root down here in the lower back, and we use it to do the pelvic and the lumbar adjusting. And we're doing some special adjusting based on Taylor's x-ray. Her hip is low on the left, so we're adjusting that. And then we use the arthro-stem adjusting instrument to do what we call head-on adjusting, which is, before she got pregnant, we did an x-ray analysis on Taylor's spine, and these adjustments are very specific from what we found on her x-ray. And this is called the rib blade. And it's a very specific adjustment to the rib cage, but also helps to correct any spinal curvatures that people have. And this adjusting instrument we're using to adjust L1. The L1, L2 area in T12 can really get locked up when you're pregnant. Has a big effect on the diaphragm, which your body goes through a lot of changes in that area. Okay, you're going to go ahead and stand up now, Taylor. There's been a lot of studies that show that women under chiropractic care have less pain in delivery, and the delivery times are shorter. So we're going to do a neck adjustment on Taylor. Sit here. This is what's called a Gonstead style neck adjustment. And Taylor responds well to this. So what we found on her x-rays and palpation is she has a left occiput, right atlas. And so this is the occiput adjustment. And then we're going to adjust her atlas. Great. Okay, now you're going to sit here facing that way, Taylor. And then again, based on her x-ray, we're doing some very specific adjustments to the upper neck. Again, this occiput C1, occiput C1, C2 has the biggest effect on the vagus nerve, which travels down to the uterus. So it's very important to make sure that stays in alignment when you're pregnant. Now we're going to work on the curve in the neck. Tuck your chin down. This is helping with the cervical curve, and I'll show you why that's real important. And then sit here facing that way. When you're pregnant, you get in this kind of posture. As your belly goes forward, you go like this, right? And if that doesn't get corrected in between pregnancies, it continues to get worse. So this is Taylor's second pregnancy. She also had chiropractic care with the first one. And when you get adjusted after, it helps you to go from this posture to this posture. Otherwise, it just keeps getting worse with each pregnancy that you have. And that puts a lot of pressure on the neck and lower back and shoulders. It can cause headaches, low back pain, leg pain. But most importantly, interfere with the uterus. Okay, now slide up. That was an anterior adjustment in the mid-back. When you're pregnant, you get a lot of stress in the middle back. So we check the leg length again, and it's balanced. So that tells us there's less pressure on the neck. And now we're going to do a couple checks of ligaments with Taylor. And we check the iliopsoas ligament and the inguinal ligaments here. Sometimes there's pressure. I can feel the baby's head right here. And so we're just checking the muscle tone right to the side of that. And if we feel anything, we do some trigger point work. And the whole idea is we're keeping the pelvis loose. So you'll hear patients talk about, or midwives talk about the Webster Technique, or let's say the baby's in a breech position and you want the baby to turn to have an easier delivery. It's not that the chiropractor's turning the baby, but by the body being in better alignment, the baby's easier to turn. And so many times after a patient gets adjusted, they'll go from a breech position into a head down position and be able to do the delivery. And midwives will commonly refer patients into the office when they know they're in this breech position. And it's not that the chiropractor is forcibly turning the baby. The chiropractor is just allowing the constraints of the pelvis to be loosened up, and there'll be room for the baby to move around. And it happens very commonly. We can give you many patients to talk to that's happened to, okay? So she's doing good there today. I just feel the baby there. Now I'm going to show you an exercise. Go ahead and come up. So this is a common pregnancy exercise we do that helps reverse some of the posture things that we see with a pregnancy. So that we'll have them flatten the stomach and then lift the head up at the same time. So you're squeezing the pelvis under like this, flattens the lower back, opens up the nerve root. At the same time, you're bringing the head up and squeezing it. Hold that for 10 seconds, and then relax. When you go into labor, this allows the whole area in here to relax, and it's a great one to do all the time to help with the posture, but especially when you go into labor, it's very helpful, okay? All right.
All right, thank you.
Thank you very much, Taylor, for helping. You guys have a great day.